The patient I'm presenting is a 19-year-old Caucasian female presenting to the clinic to establish care and for a medication refill. She's a 19-year-old female with no significant past medical history, establishing as a new patient today. She is a sophomore in college and home for the long weekend. Her parents are also patients at the clinic. She's interested in routine health maintenance and screening labs. Overall, she reports good health and she was last seen by her pediatrician about over a year ago. She has had a recent eye and dental exam that were both normal in May of this year. She denies fever, fatigue, unintentional weight changes, chest pain, shortness of breath, any changes to her bowel or bladder habits, recent infections, or vision or hearing changes. She denies anxiety, depression, mood changes, or sleep disturbances. She has been, up until recently, obtaining her oral contraceptive pill prescription through an online medical app, but would like to request a refill today. She also requests routine STI screening. She has been sexually active over the past year with 4 different male partners. Her partners are similar in age, and she is not currently in a monogamous relationship. She engages in vaginal and oral sex. She reports using condoms most of the time. In addition, she does take her oral contraceptive pills regularly. She would like to continue this current prescription of low estrin and denies any medication side effects. She states she has normal menstrual cycles. She denies a history of pregnancy, pelvic pain with sex, abnormal vaginal bleeding, abnormal discharge or breast changes. She has no history of STIs or known exposures. She has not been tested for STIs in the past, and she denies any current symptoms such as dysuria, urinary frequency, or urgency. She denies any history of intimate partner violence, and she is up to date on the full completed course of the HPV vaccination. She does report a history of seasonal allergies with intermittent rhinorrhea and nasal congestion in the spring months that is worse whenever she goes outdoors. She states she has undergone allergy testing previously and states she has allergies to various different types of pollen. She says it's well managed with cetirizine as needed. So past medical history is significant for seasonal allergic rhinitis. She does not have any past surgical history. Medications, she takes low estrin 1 milligram per 10 microgram tablets, a 20A pack, 1 pill by mouth daily for birth control. She takes 10 milligrams of cetirizine as needed for her seasonal allergies, usually in the springtime, and she denies any other prescription, over-the-counter vitamin or supplement use. She has no other allergies to food or medications besides her seasonal allergies to the various pollens that cause the rhinorrhea and nasal congestion. Her family history, her mother and father are both alive and healthy. Her maternal grandparents, she does not know their age or their health status, but they are both alive. Her paternal grandmother is alive, has a history of type 2 diabetes and osteoporosis, and her paternal grandfather is also alive and has dementia and hypertension. She has 1 healthy 17-year-old brother as well. For her social history, she is a sophomore in college at an in-state university. She currently lives in a campus dorm with a roommate. She has a good relationship with her parents and also has a good support system of friends at school. She does state she has a well-balanced diet and drinks about 1 cup of coffee a day. She gets about 7 to 8 hours of sleep per night. Occasionally, she states that she drinks alcohol socially, typically on the weekends, averaging 4 to 5 seltzers about 2 days per week. She denies a history of drinking while driving or getting in a car with others under the influence. She denies tobacco, vaping, or illicit drug use. She does endorse an active lifestyle. She goes to a 1-hour Pilates class about twice a week, and then she also reports that she walks several miles daily on campus. She applies sunscreen when outdoors and uses a seatbelt regularly when in the car. She is up to date on immunizations to her knowledge. Her last Tdap booster was at age 11, so she would be due at 21 years old, and she would like to receive the influenza vaccination today while in the office. So her review of systems was all negative. She denies any breast pain, lumps, swelling, nipple discharge, or changes to skin. She denied all GU symptoms, dysuria, frequency, urgency, hematuria. She has no acute concerns today. So her differentials are mostly for routine health maintenance and preventative care. So doing a physical exam and immunizations, contraceptive management. And also, part of the differential would be risk management for some of her lifestyle habits and behaviors. So for STIs, she's at a higher risk. She engages in some risky sexual behaviors. She's had 4 partners in the last year, inconsistent condom use. But she does have no active symptoms or concerns of an STI right now. Alcohol use, she would be a medium risk. She is underage and exhibits some signs of binge drinking behavior patterns about 2 days a week, although she doesn't currently meet the criteria for alcohol use disorder. Mental health, given her age, she did score low on the PHQ and GAD screening tools, and she denies depression, anxiety, or mood changes, but it would be something to consider for risk management. Acute infection and an undiagnosed chronic condition are both unlikely differentials. She doesn't have any acute concerns or present with any symptoms, and then her family history does not raise any concerns for genetic conditions. Her vital signs were all within normal limits. Her physical exam findings were also all within normal limits. No pelvic pain upon palpation. Diagnostics, so we did the PHQ depression screening. She scored a score of 1. The anxiety GAD screening, also a score of 1. And then the Kraft questionnaire for substance use screening, also a score of 1, which is positive. So labs ordered is an STI screening panel for HIV 1 and 2, chlamydia, gonorrhea, trich, syphilis, HSV, and hepatitis B and C. So her diagnosis codes are the annual physical exam, screening for depression, other mental health and behavioral disorders, STI screening. She has a BMI of 22, and then alcohol abuse counseling and surveillance. So for management, we did discuss routine STI screening as part of preventative health maintenance with the STI panel. Some risk factors that she has that increase her risk and make her higher risk of acquiring an STI are in multiple sexual partners in the past year, sequential sex partnerships of limited duration, she's not in a monogamous relationship, and then failing to use barrier protection consistently. So we did discuss what these risk factors are and provided education on risk reduction behaviors to prevent STIs and HIV, such as consistent condom use and reducing the number of sexual partners. We did discuss that since she's 19, it's not recommended for cervical cancer screening with the pap smear and HPV testing until she's the age of 21. We did refill her prescription for low loestrin Fae. We talked about other options for contraceptive management, including patches, vaginal rings, injections, implants, or an IUD, but she states that she would like to continue with her low loestrin Fae, but will notify the office if she wants to discuss further options in the future. For lab work, as part of a new patient visit, as just to establish some baseline lab work, we did order a CBC and a CMP with the STI panel, but she doesn't have any dietary restrictions, a heavy menstrual cycle, or any symptoms of anemia, and then also has a relatively low risk for liver or kidney issues. The screenings for depression and anxiety were, both of those scores indicated that there's no or minimal concern for depression and anxiety, so this is just something that we can continue to monitor annually unless concerns arise sooner. The Kraft score, since she has been drinking alcohol in the past 12 months with a score of 1, indicates a medium risk. She says she gave herself a 1 because sometimes she forgets things that she did while drinking alcohol. So we did discuss the risks of binge drinking, which is greater than 4 drinks per occasion, safe alcohol limits, and harm reduction strategies. This is also something that we'll reassess annually or sooner if concerns arise. She'll continue to manage her seasonal allergies with over-the-counter Zyrtec, cetirizine, 10 milligrams as needed. I did recommend adding Flonase nasal spray if her symptoms worsen and are not managed with the cetirizine. She will get the flu vaccination today in the clinic, and then we will communicate all the lab work results with her over the phone whenever they come in. If there's any abnormal results, we will schedule a telehealth or an inpatient visit. But if not, she'll follow up next year or sooner if any concerns arise.